that everyone has the mental health support and safety net that they need. We also know that some are more vulnerable to suicide than others. They include our seniors, our veterans, and our young people. The speakers with me today will talk about some of the actions Arizona is taking to specifically support them. I want to start by recognizing two leaders from our legislature whose work is saving lives. They are Senator Kate Brophy-McGee and Representative Jeff Weniger. Earlier this year, they passed a bill, Jake's Law, that requires health care insurers to cover mental health without additional barriers, just like they would cover an annual physical. Now, Jake's Law, their bill, is the law of the land. Senator Kate Brophy-McGee and Representative Jeff Weniger have worked tirelessly to make sure there are resources available for families and young people in mental health distress, and I'm grateful for their leadership and partnership. I also want to recognize Dr. Kara Christ and her excellent team at the Arizona Department of Health Services. In January, they launched Arizona's Suicide Action Plan with the goal of improving mental health, collecting new data, and ensuring treatment and support services are available in all our communities. Dr. Christ will provide an update on these efforts. When it comes to our veterans, Arizona will always honor their service while working to ensure that they have access to the benefits and support they have earned and deserve. The Arizona Department of Veterans Services, led by Colonel Wanda Wright, has made mental health one of their top priorities. Their efforts to expand peer-to-peer support and vital services, known as the Be Connected program, have received national recognition, and they've helped train thousands of people to assist with resource navigation. Colonel Wright will speak on these efforts shortly. Lastly, I want to talk about a population that is especially at risk, our young people. Tragically, among children ages 10 to 14 years old in Arizona, suicide is the leading cause of death. Many people up here today have worked extensively to provide lifelines to our teens and young people. For example, Access Director Jamie Snyder has worked closely with Superintendent of Public Instruction Kathy Hoffman and her team on an effort to get more behavioral health resources into our schools. Over the last year, clinicians across our state have provided behavioral health services to over 15,000 students on school campuses, representing a 28% increase in the number of students accessing student-based care. These services include behavioral health assessments, counseling, and therapy. And now that many students are attending class online, behavioral health providers have stepped up and transitioned to offering services via telehealth and virtual means, tapping into an expanded telehealth benefit offered by Access during this pandemic. We've laid the groundwork for efforts like these through investments, including $20 million for school counselors and other professionals. This is the first ever dedicated funding for more school counselors. In addition, last year, nearly to the day, I was proud to sign the Mitch Warnock Act. legislation to expand suicide awareness and prevention training in Arizona's public schools. The bill was sponsored by State Senator Sean Bowie, who's with us today, and I'm grateful for his continued advocacy for our students and their well-being. I also want to take a moment to commend all of the parents, school districts, nonprofits, and local governments for coming together to address the issue of suicide here in the East Valley. This all-hands-on-deck collaboration is practically unprecedented and should be looked at as a model for how communities can come together and save and improve lives. On that note, I also want to thank someone who's been working diligently on these priorities for years, State Senator J.D. Mesnard. Senator, your advocacy and passion on these issues has been tremendous, and I'm grateful. During this pandemic, Arizona has prioritized solutions that focus on the whole child, whether that's facilitating virtual learning, expanding meal assistance, or providing mental health support. We've been proud to partner with Superintendent Kathy Hoffman on these efforts, and we know we still have work to do. So to provide an update on some of the latest efforts in our school, it's my privilege to introduce Superintendent of Public Instruction, Kathy Hoffman. Superintendent.
Thank you, Governor Ducey. Good afternoon, everyone. Thank you all for joining us here today. And thank you for joining us in recognition of National Suicide Prevention Month. We all have a role to play in preventing suicide, and we know that the loss of a single student or school staff member is absolutely devastating to a school community. And as educators, we are often the first to recognize when a student or colleague is experiencing a mental health crisis. As schools across Arizona navigate this unprecedented school year, it is more important than ever that we renew our dedication to suicide prevention and mental health. Like all Arizonans, our students and staff have grappled with so many changes and hardships over the past 6 months. Last year, as Governor Ducey mentioned, over 1,500 Arizonans died by suicide. The risk is especially pronounced for young people, especially Native American students and LGBTQ students. One loss of life to suicide is one too many, which is exactly why the Arizona Department of Education's School Safety and Social Wellness team continues to work closely with Access to provide free suicide prevention trainings and other resources to school staff and community members. It is also why we made releasing Arizona's new social emotional learning competencies a priority last month. More information can be found on our website, azed.gov. This has been a difficult year for our schools, but in the face of these new challenges, our schools have shown their unwavering commitment to supporting students, families, and entire school communities. No student or educator is alone, and schools remain a safe place to talk with a trusted adult. Together, we can reduce the stigma around mental health, and we can assure that every child and adult in our schools feels safe, healthy, and supported. Thank you again for being here for this important conversation.
Thank you, Superintendent Hoffman, and thank you, Governor Ducey. So every September, we participate in Suicide Prevention Awareness Month. In 2019, suicide was the 8th leading cause of death in Arizona, claiming the lives of almost 1,500 Arizona residents. In Arizona, the age group most impacted are our older adults. While our white non-Hispanics have the highest number of suicides, our American Indian population and our veterans are the most impacted. Our rural counties are also more significantly impacted than our population centers. Compared to adults, suicide ranks higher in the leading causes of death for children, but more concerning than suicide are the upstream actions that lead to suicide. During the most recent Youth Risk Behavior Surveillance System survey, we gained some alarming insights about our state's youth. This survey occurs every 2 years, and it asks 9th through 12th graders about risk-taking behavior, and the last one was done in 2019. For example, one question to ask, during the past 12 months, did you ever feel so sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some usual activities? In 2019, over 40% of Arizona students reported feeling sad or hopeless for almost every day for 2 weeks or more. This is higher than the national estimate of 36.7%. And almost 21% of the high schoolers responded and indicated that they had contemplated suicide. 16% had made a plan, 10% reported a suicide attempt, and 4% reported that the attempt resulted in an injury that required medical attention. As a mother, this information is worrisome, and these data indicate a critical need for our coping strategies and access to mental health services for our youth. Since the release in January of the Suicide Prevention Action Plan, many activities have taken place and are especially critical during the COVID-19 pandemic. A couple of the highlights include the launch of a public-facing suicide data dashboard at azhealth.gov, supporting suicide prevention capacity as part of a worksite wellness program, promoting protective factors such as financial resources and support services that build resiliency among families and communities, screening for perinatal depression in home visiting programs, encouraging social connectedness to combat loneliness and isolation, and working on the development of a public campaign promoting social connectedness. ADHS is also currently working with the Phoenix Suns and the Phoenix Mercury to promote the Must Stop Bullying campaign, public awareness campaign, through a variety of social media and broadcast platforms in both English and Spanish. And we're coordinating the bullying prevention training for schools, school districts, and community organizations. With the onset of COVID-19, the training has been offered virtually and incorporates a focus on creating positive home climates to promote learning, prevent stress, and protect youth against cyberbullying. So far in 2020, 21 trainings have been provided statewide, reaching 638 school administrators and community partners. Last week, to switch topics, we discussed the importance of getting your influenza shot, especially with COVID-19 circulating in our community, and recommended that everyone who can get vaccinated get an immunization as soon as they can. I want to remind everybody that influenza vaccine is safe and is the best prevention tool we have against influenza. We anticipate ample supplies of influenza vaccine this year, and everyone who is 6 months or older should get their influenza shot. The way that it works is every year the vaccine starts to come out in small amounts in August. Supply will increase as we go through September, and it will become widely available by October. We'll continue to receive additional doses through January, and we anticipate having more vaccine available this year than previous years. Tomorrow, ADHS will launch our new flu public service campaign, Roll Up Your Sleeve. This encourages everyone to get an influenza shot to protect themselves and to protect others. We will be announcing more specifics about our new website with the launch. But it's not too early to get your flu shot. Vaccine is currently available in our communities, with more coming in the near future. And I encourage everyone to get their influenza shot as soon as possible. We also wanted to provide a brief update on Arizona's gradual reopening. As of this morning, 12 counties met the benchmarks for categories that allow certain businesses to open with reduced occupancy and strict public health requirements. We have 10 counties in the moderate category, and that does include Maricopa, Pima, and Pinal. And we have 2, Greenlee and La Paz, in the minimal category. To date, 1,677 gyms, Bars providing dine-in services, water parks, and movie theaters have filed attestations agreeing to open with a reduced occupancy and comply with the prevention requirements. This is critical to reducing the spread and continuing to open businesses across the state. We have had many businesses open successfully and identify best practices for implementing the requirements, but we'll continue to work with our public health partners and to protect our communities. Currently, for schools, 11 counties have met the benchmarks to return to the classroom, and many schools have made the decision to return to a hybrid learning model. We encourage parents to review their school's mitigation plans and determine the best method for education for their families. And last week, Superintendent Hoffman and I sent a joint letter to schools encouraging them to stress the importance of influenza vaccination to their staff, students, and families. From COVID-19 to influenza to suicide, there are so many challenges that people across the state are facing. So while we have prioritized suicide prevention strategies over the past few years, the impact of COVID-19 makes it more important than ever. It's important to stay socially connected. We need everyone to do their part. We need everyone to stay socially connected and continue to stop the spread of influenza and COVID-19 in our communities. Suicide is preventable, and there are resources that can help. You can find information about our suicide plan and additional resources, as well as information on influenza and COVID-19 at azhealth.gov. So now I'd like to introduce Colonel Wanda Wright, Director of the Arizona Department of Veterans Services.
Good afternoon. As veterans, we are trained to be warriors, strong, resourceful, and resilient. Stigma continues to surround the veteran community, telling us that we can't reach out for help and still be all that I just named. And that's just not true. Here are the facts. According to 2019 report, the number of veteran and military suicides has exceeded 6,000 each year from 2008 to 2017. While veterans make up just 8.5% of the total U.S. population, they account for 18% of total deaths from suicide nationally in Arizona. In Arizona, the risk of suicide is 3 times higher for veterans than non-veterans, and the risk of suicide is 4 times higher for older veterans than non-veterans. We know that completed suicides are only the tip of the iceberg of a larger, ongoing mental health crisis, and that many more veterans are struggling with suicidal ideations and attempts. In order to truly honor the service and sacrifice of our veterans, we must identify and support initiatives that help those that serve and their families in not only navigating, but also thriving in civilian life. Our Be Connected program is a statewide partnership that eases access to support and resources for the over 500,000 plus service members, veterans, and their families who call Arizona home. We want to ensure that Arizona's military and veteran community gets the services they need early enough to prevent them from feeling isolated or having suicidal ideations. The Be Connected team assists with needs such as financial assistance, VA benefits, behavioral health concerns, permanent and emergency housing options, employment, and much, much more. The program started with just 1 team member in 2017 and has since expanded to over 30 team members. Since then, Be Connected has completed over 30,000 encounters, connecting Arizonans to community resources by phone, online, or in person. We've also trained over 4,000 people, equipping them with the right tools to serve their communities. Through this program, we hear the trials of so many facing hardship. We know that 70% of the veterans who die by suicide are not connected to the VA healthcare system. This tells us that our communities must take care of our veterans. We all play a part. Check on your neighbors and loved ones. If someone says something that sounds like they may injure themselves or someone else, take action. Call 911. Report their post on Facebook. Reach out to be connected. Veterans needing resources and those who know of a veteran who need help can call Be Connected at 1-866-4-AZ-VETS or 1-866-429-8387 or visit www.beconnectedaz.org. Thank you.
Thank you, Governor Ducey, for providing me with the opportunity to talk about the work that Access has undertaken to support the state's suicide prevention efforts and deliver critically needed services to students with behavioral health needs across Arizona. Let's start with what we know. 1 in 5 youth will experience a mental health challenge at some point during their life. 17.1 million youth under the age of 18 have or have had a psychiatric condition, more than the number of children with cancer, diabetes, and AIDS combined. And 7.4% of children in the United States obtain mental or behavioral health services each year. Over the last 2 years, Access has accelerated its efforts to ensure ready access to services for students struggling with depression, anxiety, and stress. And particularly now, as students are faced with navigating an unfamiliar world in the midst of a global pandemic. The focus for Access and the Medicaid health plans that serve the state has been on meeting students where they're at, on school campuses, either through school-employed clinicians or through community-based behavioral health service providers who've entered into an agreement with the school district to offer services on campus. In addition to providing behavioral health services to over 15,000 students on campus last year, as the governor mentioned, through its Project Aware grant, Access has partnered with the Arizona Department of Education and Superintendent Hoffman, as well as 3 school districts, the Babo Kivri schools on the Tohono O'odham Nation, the Glendale Unified School District, and the Sunnyside Unified School District in Tucson, to provide suicide prevention resources, including workforce development training to over 5,000 school staff, as well as awareness training to members of the community. Access's collaboration with ADE also includes a Train the Trainer initiative aimed at expanding the reach of youth mental health first aid, an evidence-based program designed to offer guidance to parents, family members, teachers, school staff, and others on how to help an adolescent who is in crisis or experiencing a behavioral health or addiction challenge. It is estimated that the 62 individuals trained through the program will reach over 5,500 Arizonans each year. In June, Access worked with the Arizona Department of Health Services and the Crisis Response Network to launch the Resilient Arizona Crisis Counseling Program, which offers 100% free and confidential guidance to individuals, including adults and children impacted by the pandemic, providing emotional support, crisis counseling, and a connection to community resources. To date, over 10,000 individuals have been served by the program. If you or your loved ones are in need of support, simply dial 211 on your phone, and one of 6 trained behavioral health service providers will be available to assist you. In July, Access was awarded a federal emergency suicide prevention grant. The funding will be used in Pima County to bring behavioral health and domestic violence providers together to better coordinate services and support. And this fall, the Mitch Warnock Act goes into effect, requiring school staff who work with students between grades 6 and 12 to be trained in suicide prevention. Access has created a list of approved trainings and is working with school leadership on implementation and tracking. Each day, and especially now, children and young adults across the state look to us for encouragement, stability, and hope. At Access, working alongside the governor's office, policymakers, health plans providers, sister state agencies, and community stakeholders, we are grateful to be able to offer that relief to students and families, and we remain committed to exploring new and innovative ways to support Arizona's students as they live, learn, and grow. And with that, I'd like to introduce Director Maria Fuentes with the Governor's Office of Youth, Faith, and Family.
Hola, muy buenas tardes. Mi nombre es María Cristina Fuentes y soy la directora de la Oficina del Gobernador para Programas de Juventud, Fe y Familia. Estoy muy orgullosa de estar aquí junto al gobernador Ducey y la doctora Crist y nuestros colaboradores, todos unidos para enfrentar y atender la necesidad de proporcionar servicios de primer orden para los residentes de Arizona que sufren de ideación suicidia o de problemas de salud mental. Desde hace varios meses, el enfoque principal y la máxima prioridad de Arizona ha sido la salud pública. Todos unidos y trabajando para prevenir los casos de COVID a través de medidas de mitigación responsables y a la vez asegurar que el cuidado de las personas que lo necesiten esté disponible. Seguimos comprometidos con esos esfuerzos. A la misma vez, sabemos que proteger el bienestar de nuestras familias y de seres queridos conlleva más que la salud física. Implica también proteger la salud mental. El año pasado, 1.500 ciudadanos de Arizona murieron por suicidio. Eso significa que, en promedio, un suicidio ocurrió aproximadamente cada 6 horas en nuestro estado. Y eso fue antes de la pandemia. Los nuevos informes nacionales muestran unas tendencias más preocupantes. A nivel nacional, estamos viendo síntomas de depresión reportados a nivel 3 veces más alto en comparación a antes de la pandemia. El porcentaje de adultos que han reportado pensamientos suicidas es más que el doble comparado de hace 2 años. Y estas no son estadísticas, estas representan personas en nuestras vidas, nuestros padres, nuestros hijos, nuestros vecinos, nuestros amigos en nuestros trabajos. Muchos de ellos están luchando en silencio durante esta época de distanciamiento físico y de mayor estrés. Todos aquí y muchos compañeros más estamos trabajando juntos en colaboración para asegurar que todos cuenten con el apoyo que necesitan en estos tiempos tan difíciles. La doctora Crist y su equipo de salud en enero lanzaron el Plan de Acción contra el Suicidio en Arizona. Este plan tiene como objetivo mejorar la salud mental, recopilar nuevos datos y asegurar que los servicios de tratamiento y apoyo estén disponibles para todos en nuestras comunidades. La directora Wright, en colaboración con muchos de nosotros, ha hecho la salud mental de nuestros veteranos una de sus más altas prioridades. Y un gran ejemplo es el programa Be Connected, el cual ha recibido reconocimiento nacional. Por último, quiero hablar de una población que es especialmente alta en riesgo, y esos son nuestros jóvenes. Trágicamente, el suicidio es la principal causa de muerte entre los niños de 10 a 14 años. A través de los últimos 2 años hemos trabajado para aumentar los servicios de salud mental disponibles para nuestros jóvenes y nuestros adolescentes. En particular, hemos incrementado el acceso a servicios en las escuelas y ahora, dado la pandemia, también a través de la telesalud. Estos servicios incluyen evaluaciones, asesoramientos y terapias. Y estoy muy agradecida de ser parte de un grupo diverso de líderes y con la misma meta de ver la salud de todos en Arizona en términos de la salud física y la salud mental. Todos unidos podemos prevenir tragedias y asegurarnos que todo el que necesite servicios de salud mental tenga acceso a ello. Muchas gracias.
Muchas gracias, Director Fuentes, and thank you once again to everyone across our state for working every day to save lives. I think you can see that this is a top priority, but we cannot do it alone. We need everyone in the community, parents, teachers, children, coaches, friends, coworkers, and more, to know the signs of someone struggling with mental health and how to act. To get more information about suicide prevention, please visit azaccess.gov/suicide prevention. And if you are someone struggling with mental health, please know that you are never alone. There is help and there is always hope. To talk with someone immediately, call 1-800-273-TALK. Again, that number is 1-800-273-TALK. Together, we can prevent suicide and look out for one another. And with that, we'll take some questions. Patrick? So first, I want to say this has been a priority for Arizona from day one inside our administration to make certain that no one falls through the cracks or falls through the social safety net. It's part of the reason that we work so hard to balance the budget, to put up money in the rainy day fund. And over the last several months, the state of Arizona has distributed over $10.7 billion in relief funds to 1.3 million Arizonans. Today, we're able to do that. We are calling on Congress to act. We need Congress to do their job. They should stop playing partisan politics and get back to work. President Trump and the administration, through executive order, put forward dollars that Arizona was able to take advantage of, $725 million to plus up benefits, plus $300. They put those dollars forward, and what did Congress do? They went on recess. And now they're coming back, and they can't find a solution. There's time for them to act. They should act.
You've been, in all the years I've covered you, you've not exactly been a fan of Congress and their ability to act. So what's the backup plan for 400,000 Arizonans?
Arizona today has options. We have money in the bank. We've been financially responsible. But what you're asking about is a hypothetical. This is on Congress for them to do their job.
So just real quick,
That's the answer. It's on Congress. Plan ahead.
could you live on $240 a week, doesn't it?
This is on Congress. The trust fund is, I think it's 7 or 8 weeks from where it's depleted. Now, there are options for the state upon that happening. We're not there at this time right now. And like I said to the previous questioner, we retain options. There's options around dollars that we have. Our budget has weathered the storm rather well, but this has been on Congress in terms of the additional assistance. Other states have had their entire fund depleted as early as March or April or May. Arizona's is still healthy, and we have runway. Well, it's not to wait until Congress does something. It's on Congress to do something. Arizona has options regardless. I mean, part of the discussion around what we're having today is what are the options when a kid is having a mental health issue, suicide thoughts, needs additional counseling, therapy, or prevention, and the dollars that we've put forward and the dollars that we'd like to put forward to continue a focus on this subject will provide flexibilities for families and counselors depending on the situation. Because not every state is as good as Arizona. I mean, Arizona's been doing this since 1992. This is nearly 2 decades, 20 years, with improvements and reforms every year. This is one of the most important things that any state government does, and Arizona does it very well. We didn't just decide to do it in the last 6 weeks. In the last election cycle, 78% of Arizonans voted by mail. Like I said, this is something we do very well. Other states, like Nevada, in this last election cycle, mailed out millions of ballots by fiat of the county commissioners, with over 200,000 ballots returned undeliverable to people that were deceased or that were no longer living at that residence. This is not a time to experiment. This is not a time to explore. This is a time to take the tried and true, and that's what Arizona has done, and that's what we'll continue to do. I want to give a shout out to Secretary of State Katie Hobbs for the presidential preference election that she was able to conduct earlier this year with in-person voting and folks on the permanent early voting list being able to vote successfully by mail. We will have both options open. There have been investment dollars to ensure that we have a successful election in the state of Arizona. And the state of Arizona is the only state that I can speak to. I also want to say, as we get closer, we're 27 some days to ballots being dropped off in the mail, I think 54 days until Election Day, that expectations should be, with the amount of turnout and the amount of states going into this model, that it's highly likely that a winner will not be announced on the evening of November 3rd.
Thanks, Stephanie. So the recent articles that were in JAMA and the one that was provided by CDC are showing the impacts of COVID-19 on our mental health, and that as we are with our data in Arizona, we rely on our death certificates, and they're about 6 months delayed. So we won't have final numbers until this time next year for potential suicides that have come through. However, looking at where we are with our numbers, to be already at some of the same levels we were last year, we anticipate that we'll see more. I hope I'm wrong, but we do anticipate to continue adding to our suicide numbers. Yeah.
The constitutional rights of Arizonans are going to be protected. They've been protected the entire time. They're non-negotiable.
Yeah, actually, my question was related to the first question regarding the
Well, I'm going to let Dr. Chris talk to the specifics around public health and mental health. I did call out that the leading cause of death among our youth aged 10 to 14 is suicide. And I think this is an absolute tragedy. In addition to what's going on in our veteran community and our underserved communities. So Dr. Chris can talk about some of the numbers in terms of what we've seen around depression and emotional disconnection. It's also part of the reason that we're here with Superintendent of Public Instruction, Kathy Hoffman, today, where we put together a plan to safely and successfully reopen schools. We do believe inside the school environment, when it's safe, the teacher, the counselor, the parents, the peers can all be helpful in identifying someone who is suffering from depression or a mental health breakdown, in addition to the counselors and the therapists, and that our young people can then access those services. That goes not only for mental health and suicide prevention, but for child abuse and protection as well. There's so many things that are required responders and our teachers do to be helpful to our young people in our communities. Dr. Christ? I'm going to let Dr. Christ go ahead. Finish the question, please.
Now with this conference and the resources that you're announcing, what's going to be different for youth now moving forward if they are struggling with depression or thoughts of suicide? What are those resources exactly going to look like for them in terms of the home, if they are returning to school and they can talk to their teachers and anything like that?
Right. So as we continue through the pandemic, there have been a lot of resources that have been put towards mental health in the community in general, but also towards children. And so what we are hearing on the ground, we've been asked to investigate or assist with the investigation of a cluster of suicides in one of our local communities. We are hearing that there are increased deaths of despair, including drug overdoses, suicides. And so we continue to monitor that. I think with the influx of these resources, what we're going to see is we will see increased training of school counselors, of teachers that will be able to reach out, identify students that may be at risk. We've provided funding to 211 so that they can provide additional resources to people who may be struggling and need additional assistance. We will be doing these PSAs so to stay socially connected, how to reach out to people, in addition to assisting with the bullying. We did hear that that was an issue with our youth. That was one of the maternal and child health block grant topics. And so that has been another reach out, especially as we're doing more virtual learning. There's an increased potential for cyberbullying.
I want to say before Dennis's question is my heart really goes out to any parent, family, or child dealing with any of these mental health or depression issues. And I would like to ask all of our parents, especially if your children are still home, to engage in that conversation, to reach out and just check how your child is doing. We have resources, and we're going to post the website and the phone number again, but there's no substitute for early detection, the conversation, and then the counseling that follows, and encourage every parent and family to take advantage of the state resources that are available. And if you need to reach out to your local school or superintendent, even through distance learning, the counselors are still available.
Does this make the case that we need even more school counselors
Yes, it does. These data are absolutely devastating for us here in Arizona and for our school communities. And so we have made progress in this area. As was mentioned last year, the addition of $20 million dedicated to expand the school safety program to allow for that funding to be used to hire school counselors and social workers for the first time ever. So we have seen an increase since last year in the number of school counselors and social workers in our schools. But with that funding, we were only able to fund roughly half of the applications that schools requested. So there's clearly a strong need from our schools. That my view is that every school should have a counselor and or social work, because we do have very high rates of poverty in our state, and there's just the need is as evident. So I would like to see continued investment in those types of supports. And we are doing, as was mentioned too, about tons of different trainings, professional development, even with some of the CARES Act funding for our educators, but also the work that was happening pre-COVID from the department and training educators and making sure we're doing everything we can.
We have improved our student to counselor ratio in the state. We had $20 million dedicated dollars last year. If you'll recall, when we came into office, Dennis, we had a $1 billion deficit in the state, and I would challenge any other state in the nation to prove that they've put more additional dollars into K-12 education than Arizona over the last 6 years.
I just do want to follow up on one more question. I know that the revelations the other day was, the president on tape saying that he downplayed this response. Do you feel like he has been honest? Do you think that would have changed your response to this coronavirus? Had he been more forthright with you?
We have taken coronavirus serious since the first day of our first case. If you remember, our first case in Arizona was on January 27th, and we set up by January 28th an emergency operations center in our state. We were already having responsiveness from the federal government. Arizona was one of the first 5 states in the nation that on March 2nd had funding from the Centers for Disease Control for additional testing. And in Arizona, we declared a public health emergency on March 11th with our first executive order to make certain that we protected our elderly in long-term care. So we've taken it seriously the entire time. Well, you are taking a comment out of context, and if you look at our spread in Arizona from January, February, March, April, May, it wasn't until June that we saw where we had our issues with increases in cases, and on anything that we've needed in terms of responsiveness. I've shared with you about the ventilators that we need. Even when Arizona writ large wasn't going through a real challenge, Navajo Nation was. And the responsiveness and delivery from the president and the coronavirus task force has been consistent with real urgency.
Yes, thank you. That's a great question. So as early as April, we have had a vaccine task force that has been planning for the allocation and distribution of a potential vaccine so that we are ready whenever it comes out. Since April, we have been meeting with our county health partners who will also be responsible for distributing and allocating the vaccine through the state. When we had this issue back in 2009 and were responsible for getting out the 2009 influenza vaccine, We worked very closely with our community partners because it's our community providers and our large mass immunizers that are going to do the bulk of the immunizations. And so we are working to get them registered so that they are ready to be able to potentially receive direct shipment.
All right, so you are hearing from Governor Doug Ducey and Dr. Kara Chris at a press conference at Hamilton High School in Chandler. They are talking about suicide prevention, among many other things going on in our community right now, including financial aid. Governor Ducey calling on Congress to act. We'll have much more coming up on 12 News at 5.